This week's episode of Weekly Hope. I'm Kirsten Hagland, your host, and it's great to be back with you. And of course, my co-host here, Sleepy Elsa. We're very glad that you've joined us today. We have an incredible guest and a lot to dive into. So before I introduce him over there, I just want to let all of you know that this is an informal conversation. At Weekly Hope, we love to hear from you. We want to hear where you're coming from, where in the world you're signing in from, what's on your mind, and give you a chance to ask some of these incredible experts that we get on the show questions of your own and share your thoughts. So don't be afraid to post comments. We'll put them up on the screen. We'll give you shout outs and of course try to answer any of those questions or thoughts that you have. So without further ado, I want to introduce this week's guest. It's Dr. Gregory Jantz. He is a prolific author and speaker. I think some 37 books that this man has written and speaks all over the country, and is the founder of The Center, a place of hope. And we're going to hear all about that and talk with Dr. Jantz about something that he's very passionate about because he's been doing it for decades now, and that is the intersection of comorbid issues, eating disorders, depression, anxiety, addiction, and really treating the whole person. He's the expert. So Dr. Jantz, welcome.
Hey, really good to be with you today I'm looking out over the window from beautiful Seattle. Good to be with you. Thanks.
Oh, wonderful. Yes. And it's morning for you in Seattle, and it is 6 p.m. for me here. This week I'm in Germany.
Yeah.
So I think you are looking at mountains because I'm looking at semi-mountains out my window.
Yeah. Well, and isn't it great we can do this? Wow.
Oh, it's incredible. And what's really cool, Dr. Jantz, is that we get people that sign in and comment from all over the world, which is nice. We have people from Australia that come in and say hello every week, the UK, here in Germany. So your words make manifest around the globe.
Good.
So yeah. So really cool. So if you're watching, we've got some people here watching. Let us know where you're signing in from. So first of all, you've been such a great friend to Eating Disorder Hope over the years. So I want to thank you again for doing this. And you've done video series before for us, and you've got your own Facebook Live show. And you really are a pioneer in this idea, concept, et cetera, that we should be treating the whole person. And, Eating Disorder Hope is about eating disorders, but also it's sister site Addiction Hope, right? And then whenever we post articles, et cetera, and that's one of the reasons why we always love having you on, is that people that struggle with eating disorders often struggle with a lot of other things as well. So I would love to hear from you first, like what has your journey been as a treatment provider and clinician, and then founding the center? Why did you, how were you one of the first to hone in on this, and what has the journey been like so far?
Wow. And it has been a journey. What a great question. It's hard for me to imagine, but it's been 31 years. Isn't that amazing to think about it? So we coined the term a while back, whole person care, because we really believed that to have success, we've got to look at every piece of the puzzle. And so we really do see people as 1,000-piece puzzle or more. And there's a lot of different pieces of that puzzle that we need to look at for long-term success. And I really am still passionate about this. And I see that, we can treat an eating disorder, but we want to be sure that we're treating the whole person, because that's what matters for our long-term healing and recovery. And we also have an inherent belief that everybody has a purpose, and there's a meaning for our struggles. And we are to move into a zone of hope, and I'm going to say victory, and we can have that.
Yeah. Now, I've always been kind of confused or wondered, and I think a lot of people do, especially if they do struggle with a lot of different things, perhaps. Let's say they go in for treatment and they get an initial diagnosis of an eating disorder or OCD. And they go to someone else and they get, and this happens a lot with mood disorders as well. They get a diagnosis of something else.
Right.
And is there always one issue at the root of something and the other things are the branches? Or is it kind of like there are multiple roots? Which is it? Every person.
There's multiple roots. I think sometimes we get hung up, like, I got to find the reason for this, or I've got to just focus on a central root cause? Well, there could be a lot of different factors. One of the things that we discovered a while back, and in a book I wrote about emotional abuse, is almost everybody could relate to having some unmet emotional needs or living in an environment where there potentially was emotional things that were emotionally abusive and that affected us. And so we just need to look at, okay, we also have our unique body chemistry that we need to understand. We know that nutrient deficiencies can affect our mood and our mental health. And so we want to cover all those bases. Now, we know that living with an eating disorder over time is going to alter body chemistry. It's going to alter digestive process. It's going to alter brain chemistry. So we really feel, well, we've got to look at that as well. That may not have been the root cause, but over time, my body did respond, and my body has certain needs. So, and here's the other thing. If I've been struggling with an eating disorder, no matter what type, and we have a lot of different terms and mixtures for eating disorders, don't we? And
Yeah.
it gets a little confusing.
Yeah.
But no matter what the struggle has been, we don't want to get hung up on just a label. I don't want that label to become my identity. My identity is something much more.
Yeah. And I'm struck by the thought when you're talking is that these issues are so extraordinarily complex.
Yes.
And psychoeducation is a big part of someone's treatment and them learning about what it is they're dealing with. How do you advise people? Because the outside world, outside of our mental health bubble, is very judgmental and very black and white thinking. And how do you help someone to explain to their family or their friends about what they might be going through, especially if it's complex, right? If they went in for a substance abuse program and then found out that really underlying that was an eating disorder or something. How does someone even go about trying to explain to a family member or friend what they're going through?
I think one word that comes to my mind is my life has become out of balance, or I'm no longer balanced, and that means probably emotionally in my body chemistry. So I tend to look at, we want to move back to a place of balance, and so it's very complex because the way our bodies are designed, binge or purging or not eating or eating just certain things is going to have a ripple effect in other areas of my body. And so we want to look at that. We know that, for example, and there's some exciting areas going on right now in the whole area of digestion, and our intestinal flora. How does that affect our mood? So we just have to understand that it is complicated, but we can sort it out. That one thing does have a ripple effect in another area of my life. I mean, who would have thought that we could actually today identify um, uh, basically bacteria in our digestive tract that actually affects our mood? Now, isn't that just but that's how our body's made. So we want to look at all this. And, we do some things with IV therapy. We replace nutrients via IV. We start to replace amino acids for the brain. So we know that all this works together. And so we can sort it out. It is possible.
That's unbelievable. And what kind of response do you get from the medical community, right? Because I think it's and also sometimes I know there's always a lot of issue with sometimes medical doctors or primary care physicians aren't always the best at being the front line again in identifying eating disorders, right? And do they seem to be on board with this? And does the medical community seem to jive well with this? And that's so cool, IV treatment, because I mean, yeah, duh, it makes so much sense, right? I mean, food is medicine.
Yes. Well, we know that most of the time when we can explain the processes, and of course we've got a fabulous medical team, that it does make sense. If my life or lifestyle, if I was an addict, or maybe it was alcohol, over time I've depleted a lot of nutrients. I depleted B vitamins in my body, and now if I can give my body what it needs to replenish through an IV, I can feel better, my mood, my brain works better, and I can benefit more from treatment just because I'm feeling better. My brain is functioning. So it all does come together and make sense. And I think, generally speaking, medical community is excited and on board with some of the new innovations because we're seeing good results.
Oh, yeah, that's awesome. We have a good question. Rebecca asks, "Hey, lady, is there an example of an effect of an eating disorder on the body slash brain?" So, and I'm really super interested in that on the brain too, and that how, and it kind of goes into what you're just saying. I mean,
Yeah.
what happens in our brain chemically that keeps someone there too, right? Because
Sure.
we need to renourish the brain, like you said, in order to get it to a place where it can recover.
Here's what we know. Um, Brain spec imaging, and this is something that we will look at a person's brain. We know that binging, purging over time, we can actually see the areas with this imaging of the brain that it's affecting. And these areas of the brain are highlighted. So we can look at over time and see, you know, and it's just really good just to show a person, here's some things that are going on. This is how it affects. And it's not about guilting a person. It's not about um, uh, trying to control things. It's really about saying, here's some of the things that are going on, and here's how we can help. So to have a visual to see, actually in my brain,
Mhm.
this does have an effect. Um, and if I can change this, I am going to feel better. Now, there's a lot of fear, there's a lot of things that are in that. But if I can, and I always ask, if I can show a way where you could really feel better, would you be interested? And the answer is, yeah, I would be. I do want to feel differently.
Yeah.
So, and brain chemistry is one big part of that.
Yeah. And is it something where, and this I'm just curious about, where the longer that a person suffers with an eating disorder or an addiction or anxiety or depression, that those behaviors get more entrenched, that it's harder to change the brain? Does duration of symptom engagement or behavior engagement affect how well someone can recover, or does it not?
Good question. Really good question. For the most part, what we see for a person who's been more in a pure anorexic mode, the recovery time, generally speaking, does take longer, but you can get there. And
Yeah.
so I always say, let's not delay getting care. Let's not delay. Usually, what we hear from folks is, like, go, oh, I wish I wouldn't have waited so long. Or maybe you've had a lot of frustrations. Maybe you sought some help and things just haven't come together. Don't give up on getting help. I know that just that process can be at times really frustrating, because when we stay with it, and I mean stay with it, you're going to see some good results, and you won't be living with regret. We always tend to have regret if we stop or we don't do anything.
Yeah, yeah. And I'd love to hear your thoughts on, thankfully, the fact that mental health is being talked about a lot more in the public sphere.
Yes.
Even just a couple months ago, there were some very high, horrible suicides that directed a lot of attention to mental health and stigma and encouraging people to reach out and get help. As we
Yes.
see more comfort surrounding talking about treatment, access to care, mental health generally, what do you think are the dangers? Because
Yeah.
because there still could be a lot of misunderstanding. There still is a lot of stigmatization, but I don't know if I don't know. There's just I'm just concerned that there might be some unintended consequences about people, more and more people starting to be involved in this conversation, which is very sensitive.
Oh, yes. And we need, the World Health Organization tells us by year 2020, which is right around the corner, that depression will be the number one disease in the world. So they're
Oh,
calling it a disease. So if depression's the number one disease in the world, that's above heart disease, that's above cancer. That's an amazing thought. And we're living in a society and in a world where there is a lot of depression. And so we need to talk about it, but we need to talk about it from a place of solution, a place of hope.
Yeah.
Truly, and if you're suffering from depression, we've never lived in a better time with better options and better answers for depression than ever before. We have more tools in psychology and counseling. We have more tools in whole person care and physical interventions, medical interventions. So uh, there are resources. And we talk about mental health, we talk about depression and anxiety. I really want to talk about it from a place of hope. We're seeing way too many people, when we get depressed and time goes along, we can move over to despair. And
Mhm.
despair is that place where I don't see options. Despair is that place where my thinking grows irrational and I feel like committing suicide, or I feel like it'd be better off if I wasn't alive. And so I understand, and we've seen, unfortunately, some really public suicide situations, which I don't believe is always helpful because uh, that's not the path that we want to go on.
Yeah.
And, we want to be able to um have good help, move out of that desperation into a fully functioning life. And I just want to say today, no matter where you are in that continuum of struggle, there is hope. And I say that because I see it in people's lives. I see people change, and we can do this.
Yeah. No, it's so true and it's so right. The age-old question, is depression actually more common, or are people becoming more aware of maybe their own issue or a
Yeah.
family member or friends?
Yeah. I believe depression is probably increasing. And somewhere we've got to, we're using technology today, but somewhere we've got to look at what's the interference with technology and
Mhm.
social media, technology addiction.
Yeah.
We've got to look at what's everything going on that can contribute to more depression.
Mhm.
We know, for example, that a young person's brain, say 13 to 17, that brain gets overstimulated with technology and intensity. That brain can get overstimulated, and over time, it can create what we call a craving brain. That brain wants more and more stimuli, more and more. And the brain wasn't designed to work that way because it was still developing. And so we know that we can create a depressed brain by too much technology. So
Wow.
we've got to look at, what's all going on. And we're seeing addictions drop to younger ages.
Yeah.
So we're living in a addiction world where there are more ways to quickly become addicted than ever before. So all those things have to factor in as we look at the increased numbers of depression.
It's just insane.
Yeah.
And while technology can be such a good thing, obviously it's
Yes.
allowing us to do this and get this information. I mean, this incredible education
Yeah.
to places all over the world. You did actually write a book for teens on moderating technology and smartphone use and stuff.
Yeah.
What advice can you give to parents, or even for those of us who are like, okay, I need to make sure I'm getting a detox now and then? What are some easy tricks to be like, okay, I'm not going to be a Luddite and sign off technology altogether, but what boundaries can I put in place for myself or children in order to not get addicted?
And let me just confess by telling you that I have two boys. I have a 16-year-old and a 19-year-old. So technology is very
I bet that's
real
super
for
easy.
us.
Yeah.
And
Yeah.
so I talk about this from a place of living with it and personal experience. So we look at, and here's a couple different rules that we've used. When you're with somebody, be with them. And so we don't do technology at the dinner table, for example. Be fully present with the person. We also have a rule is you're not going to talk about things that are very important through a text message. Now, and I know that you may want to, and if you're angry, don't express it through a text message.
No, or an email. Never.
Yeah, right. What we want to do is always have that eye contact, get engaged with the person, because you want to work towards resolution. People will also say and do things online that typically they won't ever do in person. So decide. We also have done something where, in fact, we just did it. We did a family vacation. We were gone last week, and to pull this off was exciting. And we actually, during the day, did a family rule where we were only going to check our devices 1 hour in the morning, later in the evening, but we were going to be fully present with each other throughout the whole day and enjoy one another. So here was the test. Could we really have that technology boundary? And how did we do together? So, yeah. So really put value on relationships.
Yeah, no, it's so true. It's so true. And the amazing thing is I've been, when I've been to Africa or the Middle East, it's like you're in some places where it can be a very poor area, and people very much in need of the basics of life, and yet they have a cell phone. Everyone in the world has a mobile phone. The UN is even using mobile phone technology to get doctors' advice about pregnancy and women's health issues out to rural villages in Africa, because at least they do have a cell phone. They might not have access to a midwife or a pregnancy center or even food for the next meal perhaps, but they have a mobile phone. So it's this really, really difficult balance with the ubiquity of technology, and it's only going to get worse.
Yes, and we want to use it for good. So we have a little family rule. Everybody needs a look, a touch, and a word, and it's best to do those things in person.
Oh, I love that. Yeah, you can't touch someone via WhatsApp.
When we can.
Yeah, for sure. So before we let you go and kind of wrap up with our last few questions here, I did notice and want to mention that you have a new book coming out.
Well, let's see. I've been working on a big book on depression.
Yeah.
That comes out next year.
Oh, next year.
What we are excited about is we've put together all the things that you can do for depression, and we really do believe, really in one word, we believe in hope. Hope comes when there's a plan, and we want to help put together a plan for this problem of depression. So that's next year. This next month, I have a book coming out called Healing the Scars of Addiction. Mm-hmm. And addiction is something that we're seeing everywhere. And we know that like our other issues, once we free ourselves of addiction, we really start growing emotionally. So Healing the Scars of Addiction.
All right, great. And what's your website so that people check it out if they want to pre-order a copy?
Sure. Yeah. Easy to find us, aplaceofhope.com. aplaceofhope.com.
All right, I'm going to type that in and put it up here on the screen for the next couple of seconds. I want to ask you something, because you're the expert, that I wonder about a lot, because before I prayed for my eating disorder, I was a very judgmental person about other people.
Yeah.
About people who struggled with addiction, alcohol. And I was, this was so when I was young, 12, 13 years old, or pornography addiction or whatever, like, oh, how can they do that? And how can they be like that? And, I would just, how could you ever, I was very much like that. And then through the process of recognizing my own issues, getting treatment, getting a little bit of humility and stop being such a nasty person, I felt so much empathy for, and I understood, oh my goodness, okay, I can see how you can do something that you don't want to do, and that's not who you really are, but you get in this cycle and you can't get out. So I felt like I could understand the process of becoming addicted. But there is controversy, I think, in describe an eating disorder and an addiction in similar terms, or calling an eating disorder an addiction. How similar are the two? Is it impossible to equate them, or are there some addictive behaviors in an eating disorder?
You know, sometimes people do get offended if I say that an eating disorder is an addiction. So what we want to say is it has a lot of characteristics of an addiction, but it's even more than an addiction. So I don't really get hung up on terms too much with that, because all I know is that eating disorders ended up controlling my life, much like an addiction, and that's not taking me where I really want to go with my life. So there are those that say, you know, there's a great debate. Is there really a food addiction? And we get hung up on terminology, and then we get really judgmental. And so,
Yeah.
look, here's how I look at it. It doesn't matter the addiction or if you call it a disease. What we know is it's not taking you where you really want to go with your life. And so let's look at that. And so we also know the more I'm full of criticism, the more I'm full of judgment, the less capacity that I have for optimism for my future, the less capacity that I have for feeling grateful. And we know as soon as gratitude enters my life, I start growing. I grow emotionally, I grow in my relationships, and I increase optimism about my future. So it really is, when I'm not well, it really is to be self-critical and critical of others, and probably carry around a lot of resentment towards others. But I've stopped my personal growth when I stay there.
That's so good. I could talk to you forever. But I want to end with one last question. And that is on the topic that you just raised, and that's gratitude. How is it that we are such an ungrateful culture when we live in more abundance than ever before in history, in safety, in prosperity, and especially when you look at the history of wars, destruction, poverty, famine, you name it. How is it that we have lost our ability to have gratitude, and how do we get it back?
Isn't it true? Okay, one word comes to my mind. We also live in a culture of entitlement. And I deserve everything and I deserve it now. We live in that one click instant culture, and there's this entitlement. And I mean, I see that in my boys at times where, you know, I remember not long ago, my youngest son says, well, when do I get the iPhone 10? iPhone 10, you know, and he's 15.
I don't have an iPhone 10.
You know, it's so, and I'm just using that as an example, but we can fall into this thing of entitlement, and we lose gratitude with that. So entitlement says, I deserve everything, I deserve it right now. And it places me in a position of I'm better than you if I feel entitled. And that doesn't work.
Yeah. No, it's so good. And I think it's a really wonderful thing to apply to if you are on the recovery process, because I think, at least I think back to my own journey and those I've spoken with, if you're a perfectionist and you want to do recovery perfectly well, and it's hard to step back and have gratitude for the place that you're in the moment.
Yeah.
Because you can get so, oh, I want to be here in recovery. I want to be there. I want to be there. When pause and have gratitude for where you are and how much work you've done right now. Right?
Yep. Absolutely. Yeah. So
yeah.
With that gratitude just simply says, it's a form of love. It's a component of love. So to have gratitude says, I'm going to be more loving towards myself. I'm going to show more self-respect. I'm going to give that to others. Because if I have more gratitude, I'm in a place where I can really accelerate my personal growth. And I know that's a hard place to come to. You go, because I may be at a place of a lot of self-hatred and unhappiness about myself. So to think gratitude doesn't seem like it mixes in too well. And I understand that.
Yeah. Yeah. Well, we're all on a process, right? And even, and I love how you use the word hope so much. We have it in our, name too, Eating Disorder Hope, a center, because
that's right.
So there is hope today, or right in the second. you will feel it again, and you can feel it again. And there is hope for long-lasting recovery and change.
Hey, and you know what? You're a voice of that hope. So thank you for what you do. And Eating Disorder Hope, we need everything that you and the team are doing. So you got my vote.
Thank you. Right. Elsa, do you want to say goodbye to Dr. Jantz? Hold on. I always got to give her, we've got some Elsa fans who tune in every week. So we just want to say, Elsa would like to say goodbye to you all. She's been, I don't know if you're a dog person. I'm a major dog person, and she's walked with me through a lot of seasons in my life. So I always got to bring her on and share my joy with everyone here. So cool. All right. Well, Dr. Jantz, you rock. Thank you so much for your time and your energy and your work and your enthusiasm. Really, really appreciate your spirit.
Many, many blessings to you. Thank you.
Yeah, thank you. All right, guys, just want to let you know that was our show for today. This video is going to live at the top of our Facebook page for the rest of the week. And we've actually got 2 episodes of Weekly Hope coming next week, Tuesday and Thursday. So be on the lookout for promotions for that. We'll tell you who our guests are and what we're talking about. Make sure to sign up. I post these videos earlier in the day so you can get a reminder. It says Weekly Hope will go live at such and such a time, and you can click get a reminder so that you get a notification so you can jump right in with us. And of course, share with your friends if you think that this is something that might be helpful for their life. So we appreciate you tuning in. We'll see you next week, Tuesday and Thursday on Weekly Hope, and hope you have a beautiful, blessed rest of your day wherever you may be in the world. And we'll see you again soon. All right. Ciao.